Hi everybody, welcome to my YouTube channel Dr.Sreenivas Medical Concepts and my FB page Dr.Sreenivas Concepts. This is Dr. Sreenivas, neurologist from Rajahmundry, Andhra Pradesh, India. I am also the medical author of the books Focused Neurology and Exam Oriented Clinical Neurology. My email is sreeklpm@gmail.com. We are continuing with the series of neuroimaging concepts. So today we are going to discuss constructive interference in steady state, otherwise known as CISS. Constructive interference in steady state, neuroimaging concepts, part 16. Constructive interference in steady state. We have various sequences to find out the vascular abnormalities like angiography, whether there is ischemic penumbra like diffusion perfusion mismatch, or to pick up early infarcts like DWI, diffusion weighted imaging. But if we need to have one sequence wherein the cranial nerve abnormalities can be picked up well, it is constructive interference in steady state. So we have various disorders which affect the cranial nerves in particular. So those disorders where the cranial nerves get particularly affected and where we need to visualize the cranial nerves better, this sequence, constructive interference in steady state, the CISS, is very useful. For example, we have lesions compressing the cranial nerve like trigeminal neuralgia, wherein the trigeminal nerve can get compressed by an aberrant vessel or an adjoining vessel compressing the trigeminal nerve, or we can have the eighth nerve getting compressed by the tumors like cerebellopontine angle tumor, wherein the eighth nerve gets affected. So we have a lot of disorders where an aberrant vessels or an abnormal disorder can affect the cranial nerves, and where we need to visualize the cranial nerves better. So there are lots of MRI sequences, but this sequence, the constructive interference in steady state CISS, is especially useful for picking up cranial nerve abnormalities. So CISS, the constructive interference in steady state, is a part of fast gradient echo sequence and considered superior to the conventional MRI. The constructive interference in steady state CISS is used in the assessment of anatomical variations and various pathologies involving the cranial nerves and the central nervous system. So if we see this imaging, we'll understand it better. So this is the CISS, the high resolution slice T2 weighted sequence with a very high contrast between the cerebrospinal fluid bright and soft tissue dark. Excellent. It is excellent for visualizing the cranial nerves. So here you can see the 8th cranial coming out, and you can visualize the 8th cranial nerve very well. So this sequence, and you can always compare it to the opposite side. So this sequence is very, very useful for visualizing the cranial nerves. So this is contrast interference in steady state CISS. I hope you have liked listening to this concept. The other important concepts of clinical neurology, especially exam-oriented clinical neurology, I put in a book called Exam-Oriented Clinical Neurology, written by me, Dr. Sreenivas. This book will be very useful for students appearing for clinical neurology exams. If you're interested, this book could be purchased. The other book I've written is Focused Neurology, wherein I put all the important concepts of neurology in a question and answer format. So this book, written by me, Dr. Sreenivas, is available from all leading booksellers including Amazon. So if interested, this book could be purchased online. I hope you have enjoyed listening to this wonderful concept. If you have enjoyed it, please share the link and please like it. But do subscribe to my YouTube channel, Dr. Sreenivas Medical Concepts, which is India's leading neurology education YouTube channel, and also my FB page, Dr. Sreenivas Concepts. Thank you. Bye.